Hey, it's Kari, and I have short hair now. Yay! Yeah, I decided to donate it before I potentially lost it. So, I decided to donate it to an organization called Children with Hair Loss. If you want to hear more about this organization, I'll have a link down in the description. But we're not here to talk about my hair. No, we're here to talk about my first treatment. Before I get into more detail on that, I want to give an introduction to what my treatment is called. And it's called RCHOP. Now, what is RCHOP? Well, the R in RCHOP stands for rituximab. The C stands for cyclophosphamide. The H stands for doxorubicin hydrochloride or hydroxydonomycin. The O stands for vincristine sulfate. Wait, Kari, none of those words start with O, you say? Well, you're right. That's because the O stands for Oncovin, the brand name of vincristine sulfate. And finally, the P in RCHOP stands for prednisone. The brand name for rituximab is Rituxan. The brand name for cyclophosphamide is Cytoxan. The brand name for doxorubicin hydrochloride is adriamycin. And prednisone is just prednisone. No brand name, it's not special for some reason. And also, prednisone is actually a steroid. Rituximab targets the B cells, while doxorubicin, vincristine, and Cytoxan targets the fast-growing cells. I wanted to go over the different drug names and the brands because I'm going to be using those words interchangeably, so if I say this word when 2 seconds ago I called it something else, it's the same thing. So, yeah. So Friday, December 3rd was my first chemo treatment. And I'm recording this on December the 13th, so it's been 10 days later, a little less than 2 weeks ago. So my treatment is over at the James at OSU Medical Center. So I come in the morning, they check me in, I go to the infusion area. They take my blood pressure, and they ask me if I wanted to have a chair to have my infusion in, or if I wanted to lay on the bed, and I was like, I'll take the bed, please. Yeah, I wanted to lounge. And so I go in and I sit on the bed that they have for me, and they kind of start going over my treatment plans and which chemotherapies they're going to put in. And one of them, well, it's not a chemotherapy. This is something they give to women that are in childbearing age, and it's called Eligard. And Eligard is a birth control that puts you in mini menopause. So you're not going through periods during your chemo treatment. And the only bad thing about that is it's a shot, and they shoot it in your stomach. And so she was going over that, and I was not looking forward to getting it. But I mean, I'm obviously gonna get it since, well, that's part of my treatment. But later on in the day, it ended up that my insurance wasn't cleared to cover it yet, so my doctors are trying with my insurance to get it covered, but they couldn't do it that day, so I dodged a bullet and didn't have to get a shot in my stomach, so I was happy about that. But if and when my insurance approves it, then yeah, I'm gonna have it, so that won't be fun, getting a shot in my stomach. I mean, I don't think it's in the stomach, but it's it's subcutaneous, so, but still, they said it's pretty painful. But besides the Eligard, all the other stuff they were able to give me. So after they went over all the drugs that they were gonna be infusing in me, they went ahead and they put in the IV, and through that IV they did blood work, and I guess they use it to count your blood cells and make sure you're healthy enough to even start treatment. and like make sure you're not like anemic or anything. And so after they did the blood test, I did a urine test. I don't remember what it was for, but yeah, so I did the urine test. So after my blood work and my urine test came back alright, they started to put me on carrier fluids, which is just like a saline kind of thing. And they also made me take Tylenol and Benadryl. And in my IV, they gave me something called a HeyitsZoo, and that was for nausea, so they were pre-medicating me for nausea. And so I think that took maybe like 45 minutes-ish, maybe, for like the pre-med stuff before they started the actual chemo. And I remember like at the IV site, it was a little chilly. So after all the pre-med stuff, then they gave me the prednisone, which is the P in R-CHOP, and that was a pill, and it was one of the most disgusting things I ever tasted. Yeah, the nurse, she warned me that it wasn't going to taste very good, so I had like apple juice. They had given me apple juice, and I was like, okay, I'll take it with apple juice, and maybe that'll like mask the nasty taste. But then I like couldn't swallow it quick enough, so it like melted in my mouth, and so that just made it all worse, and yeah, it was really gross. So after I took the prednisone pill, that's when they started me on the rituximab, and that's the chemo that targets the B cells, so that's like the main chemo. And they have to give it to you very slowly the first session because they want to make sure you don't get a really bad reaction to it. And so the first session is usually the longest because they have to give it to you very slowly. So the rituximab infusion took the longest. They had to progressively up the dosage because they don't want to give you too much at once. And I knew this session was going to take like a few hours, so I was like ready to go. Like I packed my chemo bag and I had my Switch, I had puzzles, like word puzzles, and I had my phone with me, so I'm like, alright, I'm ready. I can watch videos, I can play games on my Switch or on my phone, I can do the crossword puzzles or whatever other puzzles are in this variety magazine pack thing. So I was ready to go, and I was so tired. I just wanted to sleep. And I think it was the Benadryl that made me so tired, so I barely did anything but sleep. I mean, I didn't sleep too much, but I think I just dozed off here and there, but yeah, I didn't do all the things that I thought I was going to do because I was just so tired. In the middle of my rituximab treatment, there was a doctor and a nurse that came in, and they were the ones that were going to give me the spinal injection. So that wasn't fun to look forward to. The spinal injection is methotrexate, and like I said, that's the chemo that they have to put in your spine because of the blood-brain barrier for regular chemo. So what I had to do, I had to sit up and like kind of bend over and curve my back a little bit, and they're saying it's like getting an epidural. So as I'm like bent over, they put in the lidocaine, and that's like a sharp pinch and like a kind of like a burn, I guess. And like, but like as they put more in, like you get numb. And so like after he put in the lidocaine, he was like, do you feel me touching you or something? And I couldn't, so I was like, no. So it's like, okay, so that worked. So after they did the lidocaine, that's when they did the like actual puncture. It's called a lumbar puncture. And so what they did, they took some of my spinal fluid because I guess they put that under a test to make sure there's no like cancer in the spinal fluid or any other stuff that ain't supposed to be in there. And so they take a sample of my spinal fluid, and then they put in the methotrexate. And so as they're doing that, my mom was with me, and so I was like holding her hand the whole time because I wasn't looking forward to this. And so like as they were doing it, they were kind of like talking over, like my mom was like talking about like how she got like epidurals and like the doctor's wife getting an epidural and all that. And I think they were doing it to like distract me, and I kind of needed it because I was kind of freaking out like internally, but I could like feel it a little bit when they were like putting it in, like it was a little painful, and I was like, oh, ow, ow. And so he's like, oh, where's it? And then I said like, it's a little to the right, the pain, so they can like adjust it. And so like it didn't really hurt too much, but there was a lot of pressure like in my tailbone area, and it made me like feel like I had to poop or fart. So it wasn't like super painful, but it's like, I think my problem is I knew what they were doing. I know there's a needle in my spine, and that is kind of what like freaks me out. So it did help to have like them talking so I could like be distracted. So I wasn't as freaked out as I could have been. So I think next time it happens, I'm gonna just like try to be talked to the whole time, because like there was a few pauses in between and I was just kind of like, I don't like this. So it helps to have them like talking to me so I'm not so focused on what they're doing back there. So yeah, overall I think it was more of like a mental thing than like a physically painful thing. So overall I think I took it pretty well. I mean, for someone who hates shots and medical procedures being done to them. So I hung in there. And so when they were done with the spinal injection, well, the nurse that was with the doctor, she like showed me like the vial that they took my spinal fluid in, and it just kind of looked like water. So that was interesting. And so after the lumbar puncture, they have you lay down for like an hour, because like if you're not laying down you can get like a really bad headache, because I think like part of why that happens is because they take some of the spinal fluid out, and so that can give you a headache. So you lay down, and they say like within an hour, however much they took out of you, like your body replenishes that spinal fluid. So I had to lay down for like an hour and a half-ish to make sure like I was good to go. And so during that like hour and a half of me having to lay down after the lumbar puncture, I was still doing the rituximab, as I was saying. Like I was still going through that. And so they're progressively upping the dosage, and I started to notice that my throat was feeling scratchy, and I was also getting like dry mouth a little bit, and I think that's normal. But then like the back of my throat like felt like it was burning. Like, you know when you, after you throw up in the back of your throat, like it feels burnt and like gross. It kind of felt like that, like after you throw up, but I didn't throw up. And so I told the nurses that the back of my throat was starting to like burn a little bit, and so then they stopped the rituximab like completely. They gave me steroids and Pepsid to like alleviate my new symptoms, and I guess that's just like a reaction to the rituximab. And they were asking like, you can still like breathe, right? You're not like short of breath. And I was like, yeah, I can still breathe. It's just the back of my throat. And they're like, okay, that's good. So it was just like a minor reaction. It wasn't like a severe reaction, but just out of an abundance of caution, they stopped the rituximab and then gave me the steroids and the Pepsid. And so like a little bit after that, I started feeling a little better. So then they restarted the rituximab, so that went on for a little bit longer. Like near the end of that, my heart started racing a little bit, and I was like kind of worried about that. And I was also getting lightheaded, and so I asked, like, my heart's pounding a little fast, like, is that normal? And they said it's probably because you're getting so much fluid in you from like the IV and all that, because they still had like the saline along with the rituximab. They said like that can be normal for like your heart to start racing for having like so much fluid going through you. And so I was like, okay. So it didn't seem like they were too concerned about my heart racing a little bit. But I think it got better eventually. So the rituximab took a little tiny bit longer than it usually would have, just because they had to like stop it in the middle because of my like throat feeling weird. So maybe it's probably like maybe a half hour longer than usual. So it was like 4.5 hours maybe. I don't quite remember, but it was like a longer session. But they were finally done with the rituximab treatment. And so when they were finished with that, they like flush you out with like other fluids to get you ready for the next treatment. So after they flushed me from the rituximab, then they gave me another IV, and that was the vincristine. So after they hooked me up with the vincristine IV, they actually had to get a syringe for the doxorubicin. And so the nurse, she actually used a syringe to slowly put in the doxorubicin as opposed to like having a bag of it. Doxorubicin, it's actually red, so that's why it's called the Red Devil. I guess it's like actually pretty toxic, and that's why they do it by like syringe. So like the nurse can put it in like even slower than like with a bag, because I guess it's like just that toxic, and the nurse even has to wear gloves, and like she can't get it on her hands or anything. So yeah, that's fun. And even doxorubicin, like your tears and your sweat can be red, and I didn't know that, so that's interesting. But I never had that, so that's good, I guess. But yeah, so the nurse was slowly putting it in me with a syringe. And so when she was done with that, I just kind of like sat and relaxed, waited around more for the vincristine to be done. And it was weird because I was starting to get like strange smells and tastes in my mouth. And that was something I wasn't expecting to happen. Like periodically I would just get this like kind of weird like ammonia taste maybe. I don't know, kind of like ammonia but not, I don't know. It was very strange. But I'd smell something weird, and then I'd taste it, and then I'd be fine, and it'd go away, and then it'd come back, and then it'd go away again. So that was a strange side effect I didn't expect. And so then my vincristine IV was done. They switched me to the bag of Cytoxin IV. With that, I waited again. That was like 45 more minutes or something like that. So not nearly as long as the rituximab. So the doxy, vincristine, and Cytoxin treatments, like all of those together took less time than the rituximab, because I guess the rituximab, they really gotta introduce it slowly. So the Cytoxin, that was the last of the chemo, and so when that was done, they just like flushed me with like fluids. Near the end, I was starting to get a headache, and I don't know how much of it was because the lumbar puncture can give you a headache, or I don't know how much of it was that, or if it was just a side effect of all the chemos, or maybe just a combo of both. But yeah, I started getting a little bit of a headache at the end, but not like too terrible. And so like after they flushed me out of like the last of my chemo, then they sent me home. And I remember during chemo treatment, I had to pee a lot because they were putting so much fluid in me with the IV and all that, so I had to go to the bathroom a lot. And I like to call it my ball and chain. The IV with like the monitors on it that I was attached to, I had to take that with me to the bathroom, so that was fun. I kind of dozed off a lot because I was sleepy from, I think, the Benadryl that they gave me prior to all the chemo. I twiddled around my phone a little bit and did a little bit of the puzzles. And I think like near the end my mom was getting bored because she asked me like, can we turn the TV on? And I was like, okay. So we turned the TV on. They have a TV in the room, so that's nice. And Back to the Future was on. They were having a marathon. And so we watched the end of the first one and then the beginning of the second one. So that was fun. But yeah, so I mean, overall it really wasn't terrible. I mean, like, I was nervous, obviously. I mean, it's my first time. I didn't know what to expect. But I think overall I did a pretty good job handling myself. When they sent me home, they actually gave me some more prednisone that I had to take like day 2 through 5 afterwards. And I guess that's part of your chemo, is taking the prednisone at home. And that's the yucky pill. So that wasn't fun having to swallow that for the next couple of days, but luckily I'm off that now. So I don't have to deal with the gross taste. And prednisone, like I said, is actually a steroid, and one of the symptoms can be that it can make you jittery, but luckily I never had that, so that's good. Another medication I'm on now is called Valtrex, and they use that to prevent shingles. I had chickenpox when I was like in preschool, so I have the shingles virus in me, and it's just dormant right now. Chemotherapy can like wake up the shingles virus, and so Valtrex, it is supposed to prevent the shingles virus from waking up. So that's something that I've got to be on every day for until like my treatment's over, I guess. I've also got like 2 different nausea medications that I can take. They kind of want you to like switch between them. They don't want you to take like just one type. They want you to take like one in the morning and like one in the other one in the afternoon, then the other one in the night, something like that. Kind of like switching between them. But really, my nausea hasn't really been that bad. I mean, I think it might have been worse towards the beginning, but I think it might have been more like I was being cautious, so I was taking it as like a precaution so I wouldn't get nauseous. And they also, I think those pills make me sleepy, so I've kind of not really been taking them because I don't like feeling sleepy, but really I've not really needed them lately. And I also have ginger chews, which those are good for helping with nausea, and I like those. I'd almost see them as like a regular candy, honestly, but yeah. The doxorubicin, they said it can cause hair loss. I've not had any hair loss yet, but I read that it usually takes around 2 weeks for your hair to start falling out, if it is going to fall out. So hopefully it can stay. But I mean, if it doesn't, I can accept that. I mean, hair grows back eventually. I've also read and like seen other YouTube videos that people have described that their taste changes. And for me, it's not so much my taste, it's just that my tongue feels weird. You know how when you burn your tongue, or if you eat something super spicy and like your tongue is like recovering from that? That's what my tongue feels like, but it's all the time. So that's a weird side effect. But so far my taste has been okay. It's just that my tongue is feeling weird. overall, I think I'm doing pretty good with like side effects, as like not really suffering any adverse ones, at least not yet. I know as you go farther in your treatment, the side effects get worse because it's like accumulative. So it's like you're adding more poison to your body basically, and so with each treatment it gets worse. So right now it's not too bad, but I'll let y'all know if it gets worse. I mean, that's part of this journey, is going through the bad stuff along with the good. So right now I'm doing okay, and emotionally I think I'm handling it alright so far. It might get worse as my symptoms get worse. As I get sicker, I'll probably be more emotionally drained, but right now I think I'm doing pretty good, and I know I've got prayer warriors. That keeps my spirits up too. So yeah, that's just about it. Overall, so far so good. Nothing's too bad right now. You can follow me on Instagram. It's HeyitsZoo90. It's kind of like my YouTube channel name. But yeah, I'll post pictures on my Instagram account showing what I'm going through. I've got a few already going through my first treatment. So yeah, thank you for watching. Thank you for the thoughts and prayers. They're very much appreciated. Be sure to like and comment on the video. Subscribe if you want to see more of my journey through cancer treatment. And again, thank you for watching this, and I'll see you next time. Bye.